In 1961, President Kennedy called on all Americans to rise to the challenges of the day. He knew that success depended upon the unity of efforts throughout the federal government and the nation. The Greater Boston Federal Executive Board, one of 28 across the country, fosters communication, coordination, and collaboration with federal, state, and local government agencies. This is your federal government, and I am your host, Diane LeBlanc. Hello, everyone. Today we are featuring the VA Boston healthcare system, which is part of the United States Department of Veterans Affairs. Their mission is to deliver quality and timely health care to our veterans. Our guests today are Vincent, Director of the VA Boston Healthcare System, Chuck Ritter, Chief of Patient Services, and Carolyn Mason-Wholley, who is the Women Veterans Program Manager. Welcome to each of you. Thank you very much for being here. Director I want to start with you. Tell our viewers a little bit about yourself. How long have you been with the Department of Veterans Affairs, and sort of what was your career path to bring you to this directorship?
Okay. Well, first of all, Diane, thank you for having us on your show. I've been the director here at Boston for about 18 months. I have worked for the VA system for about 30 years. So I travel all over the country, from the West Coast to the South, now to the New England area. I have worked in Connecticut, Providence, Rhode Island, and here at Boston. And I have a background in healthcare administration, so I'm very honored to serve the veterans here in the Massachusetts area. Excellent.
Well, thank you for that. So the operation that you're responsible for, the VA Boston healthcare system, it part of, again, a cabinet-level agency that, just serves our nationwide veterans. But where do you fit in that big structure?
We are, as you said, a huge cabinet-level federal agency. Nationwide, we have 350,000 employees. And we have 3 departments. VHA, which is Veterans Health Administration, that's the hospital and healthcare benefits arm of the Veteran Administration. Then we have the benefit arm and also the cemetery, which administer the burial benefit for the veterans. We are in Boston, among the 151 facilities in the healthcare system. And we are the referral facility for the 6 states here in the New England area. So 30% of our workload comes from sister facilities in the other New England state. So we serve veterans more than in addition to veterans in the Boston area.
Okay, wow, I did not realize that. So in terms of your geographic area of responsibility, it really is, it's very broad, much broader than just Boston. In terms of the hospitals and the locations that you're responsible for, what make up the VA Boston healthcare system?
So we have 3 major campuses at West Roxbury, Jamaica Plain, as well as Brockton. Then we have 5 community-based outpatient clinics. These are basically primary care physicians, like doctor offices, that provide basic primary care and basic mental health care. Okay. So they are at Framingham, Quincy, Plymouth, Causeway, Street, are the 5 that we have.
So 3 hospitals where a veteran would go for hospital level
health care. Inpatient care plus diagnostic care.
Okay, yep. And then 5 other locations that serve almost like the primary care physician's office. Right. Now, in Massachusetts, I'm aware that there are hospitals in at least 2 other communities. Correct. I think the VA has a hospital located in Bedford, Massachusetts, and one in Northampton, Massachusetts. What is your relationship to those hospitals?
Okay. So they are our sister facilities that geographically place in the middle and the western part of the state. Bedford is north of us. Bedford and ourselves are going through a transition of merging some of the clinical services. because in the huge Boston metropolitan area, even though we have two different administrations managing two facilities, we like the service to the veterans to be seamless. So when they seek medical care at Bedford, and if they need to be referred to Boston, it should be seamless to the veterans.
Absolutely.
And we are integrating some of our system to make sure that has that smooth transition. Okay. In terms of Central Western Mass, which is located in Northampton, we take care of some of their referrals, but if they need some emergency or inpatient care that they do not have locally, they contract with the local hospital to furnish that care.
Okay.
Because of the distance, it's just too far.
I was very impressed that you knew the number of employees who worked for the agency or the department nationwide. So if you don't know this number, it's okay, but how many veterans are we serving nationwide, we, the Department of Veterans Affairs?
So nationwide, we have 9 million veterans that enroll into the VA system. And on an annual basis, we serve about 7 to 8 million of them in terms of the healthcare arm of the operations, because not everyone gets sick. They don't need us. And the best thing is they don't need us. Right. But we do like them to come in to get their annual checkup so that we can help them to maintain the health and stay healthy.
Okay, so sort of drill down those numbers. How about the VA Boston healthcare system? Yeah. How many veterans are you serving annually?
We have about 80,000 enrolled veterans, okay, and we serve about 67,000 veterans a year. Oh. And as I said earlier, part of that is referral from other facilities in the New England area. Okay.
So recently, there's been some issues that have, received media attention, some very tragic stories. None of them stemmed from the Boston area, but, in other parts of the country where the timeliness of service wasn't what it needs to be. And, there's been a lots of conversation around this. I think that probably every VA hospital, or certainly if you watch the news stories, was audited as a result of these really tragic situations. Talk a little bit about that and tell me, if you were audited in Boston and how did that go?
We are part of the national audit because, as you know, as a national system, when one facility is not performing up to standard, it impacts all of us. And we take pride on one standard of care to all veterans. So we did get audited in terms of our access, and the audits show that we are doing very well. And actually, the latest number that posted on the VA national website, you can see that 96.5% of the veterans, or actually 98.5% of the veterans received their appointment within 30 days at VA Boston, which is one of the top performing facilities in the nation. We have worked hard on that. If you look at our data about 2.5 years ago, for our primary care new patient wait time, we were actually around 50 days. Oh, and now we have dropped to around 23 days. Okay. Because even before the facility, which is Phoenix, issue came up, we continue to look at our data to see where we can improve. When we see that it's get up to around 50 days, we know that we have to increase our capacity. We know that we have to increase our operations, so that we can reduce the wait time. And we have done all that, and that's why you see that our wait time is actually better than the community.
So in terms of how you're actually tracking and the measurements of success, you mentioned a website. Our viewers could go to that website, and would they see how the VA is doing as a system, or just the metrics on the individual locations? Is that all out there?
Both.
Okay.
They can see the national statistics as well as local statistics. Actually, our website, VA Boston website, had a location that you can check on our numbers of the access numbers. But if you go to the VA national website, they show all the facilities. Okay. And so earlier I talked about that we are one of high performers. You can check our numbers versus the national averages or the other facilities than you can check my words.
So the metrics, a 30-day, less than a 30-day wait time to see a primary care doctor,
Right.
is that metric? What are some of the other ways that you are looking to measure the quality of care that you're delivering? Are there other metrics out there?
Yes, there are many other metrics. Actually, one of the systems that the VA has internally is called a sale report. It's a report that looks at about 29 different indicators to compare all the VA facilities to see how well we perform. And just like a hotel, you get 1 star and 5 stars.
Right.
Boston is a 5-star facilities.
Oh.
So that nationwide, there are only 12 facilities that are 5 stars.
Wow.
And we are one of those. And with that system, we also can compare ourselves on some of the indicators with the private sector to see how we compare with some of the top performing hospitals in the country, like Massachusetts General Hospital or Brigham and Women.
Wow,
and you can see that our patient satisfactions are equal, if not better, with our community hospital in the Boston area.
Well, can I ask, because again, you're describing a situation that certainly is very good for veterans in the Boston area and beyond, quite honestly. Is Boston being looked at as a model in some of these areas? Are you being asked to provide help where it's needed?
Well, we always share our best practices.
Okay.
Actually, our secretary, the new secretary for Veterans Affairs, Secretary McDonald, just came to Boston about 3 weeks ago. And he brought 60 Minutes with him. And that show was...
No pressure there.
No. And 60 Minutes actually visited us for 2 days with the secretary. And that 60 Minutes episode was aired the Sunday before Veterans Day. So you see, I'm in the background and some of the staff also there. And we demonstrated to the secretary in 60 Minutes some of the good things that we are doing. And just because we are doing well and we have excellent quality of care, we certainly share with other facilities throughout the nation. But we are at this level of performance because we have a culture of learning and culture improvement. Although we are doing well, we still can be improved. And that's what we are doing every day, is look at areas that we can improve. And we have instituted open town hall meeting with veterans.
Okay.
We had 2 in the last 3 months. We announced it on our website and on radio stations, or anywhere that we can advertise on social media. And any veterans, any public can come and ask us questions and offer us ideas for improvement. So we are a very transparent organization.
And have those town halls been well attended?
Pretty well. Last one was a little bit slim because of the weather. But the first one, we have close to 100 participants. And they gave us some very good input. And most of them are very happy with our care.
Excellent, excellent. Well, so I'm going to come back to you because I still have a ton of questions for you. Yep. But you've brought 2 members of your leadership team with you. So, so Mr. Ritter, Chief of Patient Services.
Yes.
So you tell me a little bit about how long you've been in that position and what your career path was like.
Sure, Diane. And first of all, thank you for giving us the opportunity to speak with you anytime we have an opportunity to talk about veterans. It's something that we very much enjoy doing. I've spent 10 years now in the VA healthcare system. I've spent, my career began at the Portland VA in Portland, Oregon on the West Coast. And there I got to work with many different clinical service lines. I got to work with the VA nationally and then locally as well in some rural communities in Oregon. From there I moved to the Baltimore VA where I spent another 2 or 3 years working with our VA facility in Baltimore and Perry Point, Maryland, and then have been in the Boston area for just about a year now.
Excellent, excellent. Well, that's quite an accomplishment in a short period of time.
Thank you.
So what are the services that your folks provide to our veterans?
Sure. So I work in our business office, and in the business office we oversee many of the programs that you would traditionally view as the benefits side of healthcare, enrollment and eligibility, almost like the insurance side of the VA, if you will. And with that, we help bring new veterans into our system. We help coordinate care for veterans when they are receiving services in the community. And we work with our full complement of clinical staff at all the locations that Mr. Ring has already mentioned throughout the Boston area, in making sure that our services, that veterans are receiving the world-class services that we provide in a timely and effective manner.
So let's just start at the beginning and talk about enrollment.
Yes.
I would think that upon your date of discharge, you know, the day that you become a veteran, that you would automatically be enrolled. But obviously that's not the case. The veteran needs to take specific action. Can you talk about that?
Sure. As Mr. Ring mentioned, we're always looking at ways to improve, and a lot of veterans do make that same assumption that you just did, that on the date that they discharge from the military, that they would be automatically enrolled in the VA. To reach out to us, they do need to reach out to a VA healthcare facility, and there are multiple ways that they can do that. One, by telephone, Monday through Friday. There's a 800 number, that's 877-222-VETS. Veterans can call that 8 a.m. to 8 p.m. and talk with an enrollment specialist who can work with them, help them fill out their application, and will work with the local facility to help them enroll in that local facility. Veterans can also go online, and that's at www.va.gov/health benefits. And on that site, there are online enrollment forms where veterans can go through the process online and submit that form online. It will go to the local facility here in VA Boston if that's where they choose to get their health care. And then we'll reach out to them and help them with the rest of that process.
So how long would it take if a veteran, you know, fills it out the day after their discharge? How long is it going to take to process that paperwork so that they're set up in your system?
We can get the paperwork processed that day, and oftentimes get the veteran seen that day in one of our clinics if they have an immediate medical need. If someone has a need and comes to one of our local facilities, we'll work with them. We will get that individual enrolled in our system. I would highly suggest veterans bring a copy of their discharge papers, their DD-214, to assist with that process, or verify their service, and we will get them set up with either a primary care physician or through a general medical exam, where we can often see folks, like I said, that same day.
Okay. Now, what about the spouse or family members of veterans? Are they entitled to any care that's provided by the Department of Veterans Affairs?
The VA is a very veteran-focused organization. We specialize in providing health care for veteran-specific needs. While we do have some small programs, and the small program that most folks are familiar with is the Civilian Health and Medical Program of the VA, oftentimes referred to as CHAMPFA. That applies to only very small numbers of spouses and of family members, really for folks rated permanently and totally disabled, or recently deceased veterans rated permanently and totally disabled. So yes, there are options, but it's a relatively small group, and we really have our focus on providing health care for veterans.
Okay, so in terms of the health care for veterans, they come to you, they enroll, they want you to be their health care provider. This is a benefit that they have earned and they're entitled to. Are we giving them 100% coverage? Or are they paying a copay like, you know, I am and, you know, potentially you are when you're going? How does that work?
Sure. So we do offer the full complement of healthcare services, particularly here at VA Boston, everything from primary care to mental health care to access to world-class surgeons. We can provide that health care. We also have some unique programs to the VA, such as home telehealth programs, where we will communicate with a veteran through technology, where they receive telehealth through their home. We have very specific veteran programs focused on prosthetics and musculoskeletal issues that may be unique to the veteran need, and everything else that you can think of in between as well. In terms of copays, if the care was related to a service-connected condition, meaning the veteran experienced that condition as part of their service to their country, almost universally that care is going to be provided for free. For conditions that aren't related to a service connection, we do charge copays. They're much smaller than what happens in the private sector for healthcare, and those are $15 for primary care services and $50 for specialty care services. And in terms of medications, it's a $9 copay for a 30-day refill.
Okay. But our veterans who, you know, God forbid, have a heart attack and they need bypass surgery and it wasn't service related, they're not going to end up with a huge bill at the end of the day?
They're not going to end up with a huge bill. That's something that we can absolutely provide through the VA.
Okay. Mental health services all covered?
Yes.
Okay.
Yes.
So the things that they might need to pay a little bit more for, eyeglasses, hearing aids, talk about those.
Sure, we do provide those through the VA. It's as our veteran population is aging, we get a lot more demand for some of those things as well. There are some caveats to folks that may be eligible for those, but almost, again, universally, folks do have access to eyeglasses and hearing aids. And we suggest if a veteran is interested in those services, when they enroll, they let us know. And if they are already enrolled, work with their primary care physician to get those referrals to see a specialist.
Okay. You mentioned telemedicine. What is that?
Sure. So the VA has to change. We have to look at the needs of veterans and how they want to access services. Mm-hmm. And as an agency, one of the approaches that we've had to that is using technology and leveraging the technology that our researchers have come up with, oftentimes through the VA, and bringing those services as close to the home as possible. Whether it's looking at a skin lesion through a dermatologist that may be located 1,000 miles away, reading images from someone who may be, again, hundreds of miles away, to monitoring some vital signs with some home devices that can send that information to a nurse. The nurse will review that vital information and make sure that the veteran is living healthy in their home so that they don't have to come see us at a physical location.
And how long has that program been up and running?
Well, the program started, I would say, between 5 and 10 years ago, and as those programs have blossomed, they've become more and more of a regular part of the services that we offer, and they're services that are in high demand. Veterans really enjoy receiving services that are catered to their needs and catered to how they want to access health care, not forcing them to access us in ways that we're defining per se.
So if a veteran is set up, enrolled in your system to receive their health care through the VA Boston medical system, and God forbid there is an emergency, and they're taken to the local hospital, or they travel out of state for vacation, and they need health care, how does that work?
Well, the rules can be nuanced, but in general, I would highly suggest if someone's having a medical emergency, go to your nearest ER, take care of your health care first and foremost. That's extremely important. If a veteran is going to a non-VA facility for emergency services, so long as they let that agency know that they are a veteran, that they would like the VA to be the primary payer for that care, and so long as they do that within 72 hours of admission, most circumstances we are able to cover that care then. Like I said, there are nuances to it. Those are important. One of those is a veteran had to have been seen within the last 24 months within the VA system. And that's important to know, and a lot of veterans aren't aware of that, so I'm glad I had the opportunity to share that with you today. And that's also why we highly recommend veterans get engaged in the VA system, whether they're healthy now or not. Get themselves assigned and build that relationship with a primary care provider, and that way we're able to work with the veteran, make sure we keep folks healthy, and possibly avoid that emergency room admission altogether.
So talk to me a little bit about the Veterans Choice Program and what that's about.
So the Veterans Choice Program was just implemented in November 5th of this year, and it is a $16 billion program, and that's with a B, that is over the course of the next 3 years, or until that fund is exhausted. $6 billion of those are for reinvestment into the VA system so that we can hire staff, whether it's a scheduler, a physician, a nurse, so that we are able to continue to provide the world-class services that we do. The other $10 billion is put aside as a Veterans Choice Fund, and that fund has built the Veterans Choice Program. That program offers services to veterans in their community if one of two things applies. There's a geographic eligibility, and the geographic eligibility is based on a veteran living within 40 miles of the nearest VA facility. There are some nuances to the geographic eligibility, such as living on an island, having to circumvent a large body of water, having to take a ferry or a plane to a clinic. But for the most part, if a veteran lives more than 40 miles from a facility, they are eligible based on geography. And those veterans have received a Veterans Choice Card in the mail, and those were shipped out on November 5th of this year. The other general eligibility category is if we can't see a veteran within 30 days of either their desired date or the date that their doctor says they need to be seen. We call that the clinically indicated date. And for those folks, when they come in, we schedule an appointment. If we're unable to schedule that appointment within 30 days, we will work with that veteran, give them the 800 number for the choice program. And at that point, the veteran has the choice to call the 800 number and work with the VA to schedule an appointment within the community, or they can choose to maintain their appointment with the VA that we've already scheduled.
But the choice, okay, so I might have missed one of the little nuances. The choice only kicks in if you make the determination that they're eligible, because you can't provide them with the service within what you deem to be the appropriate amount of time.
That is correct.
Okay.
If a veteran is eligible based on geography,
that's different.
They've had a card mailed to them and with
that's
instructions. Otherwise, a veteran does have to come to the VA, engage with us first.
Okay.
We will do everything we can to see that veteran within 30 days. And we're lucky now, we have an extra program that serves as a safety net for us. If we can't see that veteran within 30 days, they now have a choice to receive that care in the community.
And I mean, this is huge. This is really sort of paradigm altering. It's just a very different way and very necessary way, especially when in some parts of the country, the backlogs are just, really creating issues. I want to talk a little bit about the 30 days because, if I need to go to a doctor, and sometimes if I need a specialist, it depends upon, how quickly I need to see them. But if I'm in a position and I don't feel well, I'm sick, I'm calling, I might not get in to see the doctor, but I'm going to see a nurse practitioner. It's probably going to happen within 2 days. So if somebody were to, call and say, hey, I'm running a fever of 103, I know you're not going to tell them 30 days. What are you going to tell them?
Sure. It's inappropriate to make anyone wait when they need that medical care now. And the VA recognizes that fully. And we have services located throughout the community, whether it's one of our major facilities or community-based clinics. And many of those clinics can offer same-day services for those veterans. And if their primary care provider can't, we have urgent care located at many of our campuses as well to see those urgent issues.
If I may
Yeah, please.
add to it, earlier I mentioned to you that our wait time for a brand new patient that like to join the VA for primary care is about 23 days. But for existing patient, it's a day and a half.
Okay.
So we have open access. They can walk in if they have some urgent needs. And if they can wait a few hours, the next day they will get an appointment.
And I think that is really good information for people to hear, because again, you hear the tragic stories, and that 30 days has gotten a lot of play, and sort of the public perception is that you're waiting 30 days for everything, or that the VA thinks that as long as we get it done in 30 days, that's good, but it's really a day and a half
for
if we're
brand new
existing.
Patient, if you are one
Right.
of the 67,000
Right.
that we are serving, it's less than 2 days.
You're getting your care. Okay, all right, guys. You're off the hook for a little bit. I'm going to turn to Carolyn. You are the Women Veterans Program Manager.
Yes.
You get that same basic question. How long have you been with the Department of Veterans Affairs? And talk a little about your career path.
Sure. Thank you for having me. I appreciate it. I'm Carolyn Mason-Wholley, as you said. I have been with the VA actually since I was a student. I came on an internship. It was an excellent internship, and at the end I was applied for a position and was offered the position. I worked in mental health down on the Brockton campus, in community care, inpatient care, and psychiatry triage in the urgent care clinic that Chuck was just talking about. And the Woman Veterans Program Manager position opened up about a little over 5 years ago. I was hired into this position. And I thought it was an interesting position for me because it brings together my social work background with my some of my other skills that I developed prior to going to school for social work, systems analysis, data training, things like that, marketing.
Excellent.
So it's a good collaboration for me. And as Women Veterans Program Manager, my job is to make sure that any woman walking in the door at VA Boston gets the health care that they need, when they need it, in a way that treats them with dignity and respect.
So a couple things. This position or this entity focusing specifically on women, how long has that been part of the structure?
So the position of Women Veterans Program Manager was actually introduced some number of years ago. It wasn't until 2008 when then Secretary Shinseki came to the VA and said, look, our care for women needs to be stepped up. And he turned the Women Veterans Program Manager position into a full-time position at every facility. So no matter where somebody receives their care, if they walk into the main facility and say, I'm a woman, I want to see the Women Veterans Program Manager, she can find somebody that is her advocate.
So does a female veteran, they need to make that proclamation that they're looking to see the female Veterans Program Manager, or if they are a female, are they automatically directed to have a touch with your department?
A woman veteran, when they walk into our facility, is treated like the other veterans. They are there, if they're enrolling, they follow the same process as the men. They are actually given a choice of whether they want their care in a gender-neutral clinic or whether they want it in a women's-only clinic. So we do have a couple of different women's health clinics, one in JP, one in Brockton. But every site where we have primary care, we have women's health providers as well.
Are the challenges in serving female veterans different?
The challenges are different in that this is a very small population in comparison to the overall male population. So of the 67,000 veterans that are receiving their care at VA Boston, about 3,500 of them are women. We need to make sure that anybody providing care to those women, that they know the issues, healthcare issues, mental health issues, socioeconomic issues that a woman veteran might experience as she comes in, when she comes in the door, making sure that the providers and our nurses and our staff take care of the veterans in terms of their privacy, any gender-specific needs. You may think about an ER in the VA healthcare system. For many, many years, it was a very male-dominated facility organization, and a woman coming into the ER, particularly say if she was pregnant. This is a rather new, growing issue that we're dealing with. So those providers need to really step up and refresh those skills and really figure out, how do I take care of a woman when she's coming in my doors?
So, I mean, and certainly that makes sense, just in sort of terms of the evolution and more women be joining the military and becoming veterans. And so this is a response to make sure that needs, perhaps specific to women, are addressed. So in terms of that number, 3,500 female veterans, that's the approximate number receiving services from the VA Boston Medical system?
Yes.
Okay. Now, is that the overall number, or and maybe what percentage of that number actually is taking advantage of the services that your organization provides?
So we actually have more women taking advantage of our services in VA Boston than are actually enrolled in VA Boston. So we have, there are about 300, 400 more women that are coming to us from other facilities. We are a tertiary referral service for VA, for the New England area. We have many women that come down for more specialized gynecology services, women's imaging, women's mental health services, things that may not be as developed at some of the smaller facilities.
Good. So again, I feel like we're just, only touching the surface, and we are only touching the surface of a lot of these issues. But I wanted to talk about homeless veterans, male and female. How does the VA Boston provide medical care to our homeless veterans? And that can be for anybody.
Well, we have a very vibrant homeless veterans program. We have a full-time homeless veterans coordinator, and that he has a staff of maybe 30 social workers that outreach to homeless veterans, as well as make sure that homeless veterans that live in what we call hot voucher housing are being taken care of. Because one of the study has indicated that for people that get out of homelessness and be independent, is that first of all, you have to have a stable home environment. So the VA in the last 3-4 years has exerted a lot of resources and energy to look at the homeless populations. The latest count, what we call PIT count, point in time count, in the Boston area, we have about 409 veterans that are still waiting for us to work with them, or they are willing to work with us to get into a stable environment. So we partner with organizations like New England Center for Homelessness in Court Street here in Boston. They help to house some of our veterans. We have, as I mentioned earlier, have hot voucher that put veterans into a stable home environment, and then they can either work on their substance abuse issues, and then find a job, and we have education training program to help them out. So in the last 4 or 5 years, the VA has reduced the homeless population nationwide by at least 50%.
Wow, that's incredible.
And we have a goal of, by the end of 2015, we hope to get to what we call functional zero, that there are always people become homeless, but hopefully we'll get to a point that the number would be smaller than 409 that we counted last time.
I was actually in a meeting probably about 3 years back, and there were some senior people from the VA there, senior people from Health and Human Services, as well as the Department of Housing and Urban Development, and our topic was veterans homelessness. And at that point in time, I mean, just for the Massachusetts area, they were trying to get a handle on the number.
Yes.
And it's not easy to do. So those services and that outreach that you've just described, is it any different for female homeless veterans, or is it pretty much the same?
The women are taking advantage of the same services as the men. The HUD-VASH program has been particularly effective for some of our women vets with young children. It's been very helpful for that population.
Actually, the New England Center for Homelessness is getting a capital project to build one wing of their facilities for female veterans.
Really? And where will that be?
It's in Court Street.
It's right at Court Street. Okay,
yep.
wow.
And they also have a 16-bed dorm there at the New England Center for Homeless Veterans.
Okay. So, and I think you mentioned that you've got 30 outreach workers in working on this issue of veterans homelessness. As we've talked about the challenges that the Department of Veterans Affairs faces in delivering timely, quality health care. We hear, and when anybody who watched 60 Minutes heard the Secretary talk about the challenges with staffing and personnel and finding the right people and bringing them on board. Talk a little bit about that. I mean, I think I'd like for our viewers to know how we stand in Boston in that regard, but in general, what are the key positions that the VA needs to hire for? If anybody's interested, what do they do?
Actually, I just checked this morning. We have over 300 vacancies.
Wow.
But we have about close to 4,000 employees. So you're looking at about a 10% vacancy rate.
Okay.
So we are hiring physicians, we are hiring nurses, we are hiring administrative support positions. Just like any federal jobs, you go to USA job, and there's an announcement, and then you can apply through that process. But if you are physicians or nurses, you can talk to our human resource department because the process is, even though you can go to USA job, but the recruitment process is a little bit different because of how we recruit for physicians and nurses.
Well, and I would hope so. I want to interject. I've been a federal employee for 37 years. I've loved every minute of my federal career. The federal government's been very good to me. But when I think of doctors and nurses and providing care to our nation's veterans, our heroes, I don't exactly think of people out scoping around on USA jobs. And you know, I mean, I'm wondering, are you able to be competitive in terms of the salaries that you offer? You have a compelling mission, so I can understand people just wanting to come and wanting to serve their country by serving the veterans who served our country. But still, how about compensation? Are you able to be competitive?
So our salary structure for physicians and nurses are relatively competitive.
Okay.
We are not the wage leader. At the government, we cannot be the wage leader. But we are relatively competitive. But we have other incentive, like we can pay back your school loan, up to $120,000. Of course, it's spread out.
Is that for nurses as well?
For nurses and pharmacists,
Wow.
for physicians. If you're eligible, that can be part of the incentive for you.
Okay.
It's not 1 year that we pay back $120,000,
Right.
but it's spread about 5 years.
Right.
And that you have to make that commitment to stay
Absolutely.
with us. That's why it's an incentive.
Right.
So we have other incentive that would allow us to make it attractive to you to join the system. Additionally, we are a major research facility in the whole VA system. Our research budget actually exceeded $60 million a year.
Wow.
And we are affiliated with Harvard Medical School. We are affiliated with Boston University Medical School. And we are affiliated with 6 nursing schools in our area. Actually, we have nurse residency program, kind of like medical residency program, that you stay with us for a year as a new graduated nurses so that you can gain the training, gain the real world experience, and then we hire you on as a nurse in the VA system. So there are many attractive features that we are putting forth in our VA system to gain the necessary professionals that we need.
So the focus on research certainly being Boston-based with the institutions that you have around to partner with, that makes sense. Is your research, I mean, what's the focus of the research? Are there particular areas?
Focus research in PTSD.
Okay.
We have what we call a Million Veterans Program. It's a national program that only the VA have the capacity to do. It's a program that will get samples from 1 million veterans nationwide so that we can genotype the gene for future research. It will be a huge database. Actually, in our Jamaica Plain campus, we have a repository for that samples that will be able to house that 1 million veterans that donated that sample to us. That would be the largest in the world.
That's incredible.
Located in Jamaica Plain. So those are just two very areas that I'd like to highlight. But we are a leader in spinal cord injury, in some of the robotic internal prosthesis for veterans. So a lot of research.
Absolutely. So you mentioned some of the key positions, but is the VA also looking for administrative staff, computer folks? Are you looking for folks in all areas? Do either of you have staffing shortages in the areas that you're responsible for?
Chuck, you can speak up. You have some vacancies.
Sure, we do have vacancies. It's like Mr. Ng said, it runs about 10% in my service as well. Luckily, we have dedicated staff that are able to keep up some of those deficits caused by those vacancies, but focus primarily on administrative areas. We do work with some of the grad schools in the Boston area as well as some of the undergrad programs to bring in students so they can learn the VA system and they can learn healthcare and healthcare management in general. And so the VA, it builds a culture of learning. And I started in the VA through a graduate health program. And it was something that I never expected to want to work at the VA. But after a few short months, it was something I couldn't imagine doing something else. You mentioned that we're a mission-based organization, and we're able to recruit based on that mission alone sometimes. But we definitely need talent, whether it's a computer programmer, someone familiar with coding and billing, or someone who is focused on customer service. We need talent, and we do everything we can to work with the local institutions to get it. And I think VA Boston and the VA in general is just a really wonderful place to work.
I'd like to add one more thing to share with you, that VA Boston has been 5 years in a row now, be the top 100 employers in the Globe survey.
Wow.
So 5 years in a row. So we are doing very well in terms of employee satisfaction, and that it's quite an accomplishment for us.
That really is an accomplishment because in general, I mean, again, as federal employees, we all get the results of those surveys and that come out from the Office of Personnel Management and such, and we have different things that happen, and employee satisfaction isn't always high, so that really, so it's a good place to work.
Right, it's a good place to work. We are part of the largest employer section, and actually last year we ranked 20. This year we ranked 14. Actually, we improved our ranking.
You continue to get better. Carolyn, how about in your operation?
We actually have been growing. We're looking at expanding some of our services, adding more in terms of primary care providers who are willing and able to do specialized care for women. We have a mental health, women's health psychology fellowship and a medical fellowship in women's health that we're trying to really promote and look at this time of year. It's expanding.
There you go. Excellent. I mean, all good news. Most federal agencies aren't expanding, and they don't need to in many cases, but this is an area where, I mean, clearly, again, mission-focused, quality, timely health care to our nation's veterans who really, they've earned this and they're entitled to it. So, Carolyn, what have you not told me about the women's program that our viewers need to know?
I think one of the most important things is that Care for Women spans the spectrum from inpatient services, residential programs, outpatient programs, transitional residences. We at VA Boston, we have services throughout each of those different elements, specifically for women.
Excellent. Chuck, anything that I've not given you an opportunity to share with our viewers that you would like to tell them?
I think a lot of veterans aren't aware of the programs that we offer, whether it's in their community, whether it's through virtual modalities or at our large campuses. A lot of veterans feel as though they need to save a spot for somebody else, and I would encourage those veterans, come see us. We offer world-class services, we offer them timely, and I think we would surprise a lot of folks who have chosen not to use us in the past. And so I would recommend anyone out there listening, give the VA a shot. Come see us, and I think we'll surprise you, and I think you would choose to use us as your healthcare provider.
Excellent. Mr. Ng, so
Yes.
if somebody wants to get in touch with you, get in touch with your leadership team, how does that happen?
So I'm sure that throughout the show here, we have some 800 number that you can call to join our healthcare system. But if you like me and like to offer me suggestions or any questions that you have, you can, I'm going to show my email address. It's bostondirectorva.gov. And you can write me, and I will work with whoever that write me to answer your questions or address any issues that they have.
Excellent. You know, you've touched on some of the partners that you work with to make sure that you're delivering the best care possible. But how do you work with the state Veterans Affairs
Right.
folks, and how do you work with the local veteran service agent that might be in a community? I mean, when you mentioned the town halls that you do, I thought to myself, gee, I wonder if our local veteran service agent knew about that. So what do those partnerships look like? What's the communication around
So
that?
that's a great question, Diane. We work very closely with the state. They are our full partner in providing care to our veterans. Coleman Nee, who is the secretary for the Veterans Affairs here in the state of Massachusetts, and I meet often to talk about the state program, talk about the federal program, how we can complement each other. You know, state have two state veterans home, one in Chelsea, which is close to Boston area. We are working closely with them that actually we like to share the medical record with them, that because their patients are our patients. And with two separate systems, sometimes we have to get the paper to be shipped over to Chelsea and vice versa. That is not the best arrangement. So we are working on that. They can gain access to our electronic medical record, that they can, so that we can have better care, avoid duplication of tests. So those are the partnerships that we have.
And that really is so important. It does need to be about seamless service to the veteran. And, you know, we all think we're, you know, doing such a good job, and we are doing a better job, and we're making more information available, and we say, go to this website, go to that. But we don't want to send our veterans to 10 different websites. We want them to come to one place and get the services and the care that again, that they have earned and are entitled to. So what would you like to say to our viewers before we wrap this up?
Okay. So again, thank you, Diane, for this opportunity. If you look at the Veterans Healthcare Delivery System, there's one feature that you won't get in other healthcare plans. It's a continuum of care. When you join the VA system, you start out with primary care, and you can get specialty care, you can get nursing home care, you can get home care, you get telehealth care, and when you need it, you get hospice care, palliative care. So it's a continuum, and it's coordinated. If you are in a health plan, you have to coordinate the care yourself. We do our best to coordinate this continuum care for the veterans. So it's a great feature in terms of health benefit that we provide our veterans. And for the audience out there who are veterans, first of all, I'd like to thank you for your service, and that we are here for you. You have earned your benefits, and as you can see through this interview, we are very high-performing organizations, provide high quality of medical care, and I'm honored to be the director of this facility and here to serve all the veterans. And that for those public that like to join the VA system, it's a very good system to work in. You know, it has a very noble mission, and that there are many people that have joined the system, just like Chuck. Initially, they said, okay, I'll join the system. Then they know that this is a system for them, and they stay with us for a long time. And that's what I like to offer you is join our system, and if you're veterans, more than happy to have you as employees. 33% of our employees are veterans, veterans serving veterans. And so it's a great system to work, and I'm proud to be a director of the Boston VA.
So, well, thank you for that. And again, we've only touched the surface of so many important topics. I hope that maybe you'll agree to come back and bring some other members of your leadership team with you so that we can cover those significant areas as well and delve more into that continuum of care.
Excellent.
So I want to thank our guests for being with us today and for helping us to better understand the work of the VA Boston healthcare system, and in particular, what they are doing to ensure the timely delivery of quality medical services to our nation's veterans. I thank you for watching, and I hope that you will continue to join us as we feature other federal agencies on your federal government.